brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafa adai, everybody, and welcome back. As promised, we are talking about podiatry today. Now, if you don't know or you don't have Wikipedia right by you, it is the study of the foot. Now, of course, there's a bunch of stuff that could go wrong with the foot. Dr. Jitka Lom from Express Care is here. Now, Doctor, we've talked about, ankle sprains, and we may have talked about ingrown toenails before. I'm sure we'll get to that. But let's try and differentiate some of the more common abnormalities of the feet. Like, is a corn and a bunion the same thing?
No, but that's a great question.
It was for me when I was growing up.
Corns are, okay, let's start with bunions. Bunions are deformities of the foot of the first metatarsal of the foot, which is this part here. It looks like your foot's like turned in, kind of like a V shape of the toes. On the big toe, right. Thank you. And that comes from basically wearing very tight shoes that kind of compress your toes and force them into a V. And they tend to show up sort of in middle age after you've been wearing the wrong shoes for many, many years.
Like if you're wearing wingtip shoes?
Wingtips and high heels.
Oh.
Yeah. And as far as corns, they're thickenings on the sole of the foot, or sometimes on the top of the foot as well, where shoes and so on have been rubbing too much. Kind of like, think of like having a stone in your shoe. Basically, there's too much pressure from the inside of a bone rubbing on the sole of the foot all the time, or sometimes on the surface. Basically, it gets thick. And sometimes people think they're warts, but they're not. They're just a callus. Really, a corn is like a callus.
Yeah, so it's like it's a much harder blister. So it's not like the skin rubbing against skin. That's actually bone.
Well, the bone sort of is forcing that to happen. The pressure of the foot on the skin is forcing that callus to be formed.
Now, aside from discomfort, are there long-term problems that can come about from this?
Well, long-term, the discomfort leads to immobility. People, have such terrible pain in their feet that they really can't walk, and surgeries and so on. So those would be the sort of long-term consequences of poor footwear.
Okay, now something else a lot of people here have, because everybody here loves wearing Zoris. I mean, it's if you live on Guam and okay, well, if you just came to Guam and you live on base, the flip-flops, we call them Zoris, you will, like, in a month, guarantee, or less.
Yeah.
But ingrown toenails and problems of bacteria beneath the nail.
Okay.
How do you treat that as a physician?
Okay. Well, ingrown toenails tend to happen because of the way you cut your nails. So when you look at your toenail, you should cut straight across, sort of in a square shape. Try not to dig down on the sides of the nail into sort of like the, what they do in the salons. They just kind of dig down in there and try to get stuff out. Try not to do that, because you will sort of make yourself more prone to getting an ingrown toenail, especially bacteria can get in there if you're not using clean instruments. So you should just wash your feet and try to clip straight across, or use a nail clipper.
It's just kind of like a jagged edge that when the nail starts to grow back in, it just juts right into your flesh.
That's exactly right.
It can be very, very painful.
It can be. Sometimes you need antibiotics. Sometimes you actually need to remove part of the nail if it continues to recur. So best thing is prevention. Just keep clipping your nails straight across.
Now here's one thing that I wasn't aware of. What is midfoot arthritis?
Well, midfoot arthritis can occur from a variety of reasons. Diabetes can make you prone to it, so can obesity. And again, footwear, where basically the middle portion of the foot develops wear and tear, and that results in swelling and pain.
Now, I'm not sure, but of course, you're a very proud Canadian. You came to Guam, and you're now a very proud Guamanian. But how much of a problem do you see here with people having extreme arches in their feet?
Well, actually, the arch problem isn't so big here, because people, like you said earlier, tend to wear Zoris, which are actually pretty good for us as children.
Or conversely, with flat feet.
Right. Flat feet might be more of a problem here, with not enough arch support. But for children, the best thing is to run around barefoot, like we did for, thousands and thousands of years. But of course, they need to wear shoes when they're running around on pavement or whatever. So Zoris are actually fine for kids. As we get heavier, though, we start to collapse our arch. So we talked about childhood obesity a while back, and so if your child is quite heavy, they may benefit from some arch support. Okay,
well, that's a perfect segue, because when I was a kid, we learned in school, and my parents would always tell me, don't run around barefoot, especially out here, because if you run around like on the red dirt, you may get worms or stuff like that and everything. So what are some of the consequences of running around, barefoot, maybe in the water or on dirt, maybe in the mud.
Well, that is true. Okay, I'm talking about in a safe place in a yard or on the beach or whatever, where you're not going to step on something sharp, because that's the biggest hazard.
Right.
A sharp thing in your foot, and it's amazing how things can sort of go into your foot, penetrate, and actually be almost hidden. You can see them on an X-ray, but from the outside you can just see a tiny puncture wound sometimes. So if you step on something sharp, just do ask your doctor to get an X-ray for you to verify that you didn't get a piece of glass deep inside the foot or a nail or something like that. And you'll need a tetanus shot to be updated.
Is there a problem with you actually getting worms? I guess that's one of those myths.
Yeah, worms from your feet, probably not on Guam, maybe in places in Africa. Yeah.
Okay, very, very cool. Well, we do have a lot more topics that we want to cover, so sit tight, and you sit tight out there, because we will be back. Fascinating topic, so please stay with us. We're back after this.